Good morning, APOSI peeps. Welcome back to our Wednesday Wellness webinar. For today's topic, we will differentiate spondylosis, spondylolysis, and of course, spondylolisthesis. So we have discussion outline, which includes definition, sign and symptoms, causes, diagnosis, treatment, and of course, prevention. So first, let us know what is spondylosis. Spondylosis is a type of arthritis spread by wear and tear to the spine, and it happens when the discs and joints degenerate, and when the bony spur grow on the vertebra or bone. And these changes can impair the spine movement and affect the nerves and other function. We all know that our backbone, vertebral column, or what we call spine, is consists of vertebra and separated by a disc. And the basic function of our backbone is to protect our spinal cord or spinal nerves that passes by between the vertebra. The special function of the disc that I have mentioned, it acts as a shock absorber to our spine and allows slight mobility to the spine. So over time, when the disc between our vertebra shrink and your spine is not mobile anymore, every time that we move, nagkakaroon ng kiskisan yung bawat vertebra natin, which cause the bony spur to grow in our vertebra, which can lead to spondylosis. Spondylolysis. Spondylolysis is a stress fracture through the pars intercalaris of the lumbar vertebra. So pars intercalaris is located at the lumbar vertebra. It is a thin bone segment joining the two vertebra. So as you can see in this picture below, this is the pars intercalaris joining superior facet and inferior facet. So in other words, spondylolysis, it is the fracture in pars intercalaris. So let us know what is spondylolisthesis. It means that the vertebra move more than they should be, or the vertebra split out of place on the vertebra below. So as you can see in the picture below, this is the normal alignment of our back. So kapag nagkaroon ka ng spondylolisthesis, one of your vertebra split out of place or nag-move forward or backward, which can cause the nerve that passes by between your vertebra put pressure sa may times na nakaka-experience ka ng lower back pain or in our scenario, may leg pain ka na rin na-experience. Let us know naman what are the causes of these three diseases in our spine. So, a little trivia lang to share with you. Pag sinabi nating spondy, it means vertebra. So, for spondylosis, it is common for elderly patient kasi nga ang most commonly called ng spondylosis is osteoarthritis in our spine. So kung may osteoarthritis tayo sa knee, meron tayong tinatawag na osteoarthritis in the spine, which is known as spondylosis. Then for spondylolysis and spondylolisthesis, it is common for children and adolescent patients that engage in sports such as gymnastics, weightlifting, or soccer. So for spondylosis causes, it is related with aging kasi nga yung nagkakaroon ng osteoarthritis, most commonly is yung mga elderly patient. Then heredity kasi may mga tao na ipinanganak na walang disc o kaya yung vertebra nila is manipis, which causes the bony spur to grow in our vertebra. So that can lead to spondylosis. Then lifestyle, it is related for those patient na kulang sa exercise or naninigarilyo. Because for smoking, it increase the progression of aging. So pinapabilis niya yung pagtanda ng bones natin. Then for the generation of vertebra or disc, so na-mention ko kanina na kapag nawala yung vertebra na isa o kaya nawala yung disc na function niya is shock absorber, may possibility na yung vertebra natin every time na nagbubunot tayo is nagkikiskisan, and over time, nagkakaroon ng bony spur sa vertebra na yun, which cause to spondylosis. Then for spondylolysis naman, pag sinabing spondylolysis, it means that the pars intercalaris is fractured. So, nagkakaroon ng fracture, bakit ba? Kasi nagkakaroon ng excessive or repetitive bending backwards, which is nakikita natin for gymnastic na patient, overuse and hyperextension of the back. Then heredity, Since nga sa spondylolysis, yung first intercalaris natin, thin bone lang siya na nagko-connect ng two vertebra. So, in heredity, merong tao na ipinanganak siya na yung vertebrae niya is manipis. So, kung yung first intercalaris na part is manipis na siya, tapos yung vertebra mo is manipis na. So, konting pressure lang na mabibigay natin sa spine natin, possible na magkaroon ng fracture that can lead to spondylolysis. Then for spondylolisthesis, it is about the slippage or pag-move ng isang vertebra natin sa normal alignment. So it is related with the age, dun sa mga patient na nag-engage in sport. Hereditary din siya, just like my explanation with spondylolysis na yung vertebra niya manipis. So pag pinanganak na yun, pwedeng magkaroon ng fracture and yung isang vertebra natin ma-move forward or backward. Then degeneration of vertebra and disc. So pag nagkaroon ng degeneration sa magkapatong na vertebra and may vertebra pa sa taas, kapag nawala yung isang vertebra, pwedeng bumaba yung isang vertebra and mag-move forward or backward. That can lead to spondylolisthesis, then trauma or fracture. So as you can see, for spondylosis, may mga causes sila na related sa spondylosis and spondylolysis. So, over time, kapag si spondylosis hindi siya naagapan, it can lead to spondylolisthesis. And as well as spondylolysis, pag nagkaroon ng fracture yung first intercalaris, pwede mag-move forward or backward yung vertebra natin. Then, for symptoms, for spondylolysis, the most common symptoms is stiffness and mild pain, worse following certain movements or long periods without moving. So, kung compare natin yung spondylosis kasi OA of the spine nga siya or osteoarthritis, kung compare natin siya dun sa patient na may osteoarthritis sa tuhod, mapansin nyo na kapag naka-stay put lang isang patient o kaya naka-prolong sitting lang siya, sumasakit yung tuhod niya. So, same din to with osteoarthritis in our spine. So, kapag in certain movement, in certain position, naka-stick lang siya doon, possible yung pressure na meron yung spine natin is nagkakos ng pain or yung nerves na dumadaan doon is naiipit kaya naka-experience tayo ng pain. Then for spondylolysis and spondylolisthesis, yung pain na na-experience nila is similar to muscle strain. Then yung pain can radiate to the buttocks or back of our thighs. It worsen with activities and improve with rest. So, for spondylolysis and spondylolisthesis, so may possibility kasi yung dumadaan na nerves sa vertebra natin, naiipit. So, every time na may gagawin tayong movement, possible kung mag-move forward tayo, maiipit siya, backward, sideward. So, kaya ang na-recommend madalas ni doctor dito is rest talaga. Kasi kapag nakarest tayo, di magkakaroon ng pressure yung spinal nerves natin. Siyempre, naka-experience din sila ng back stiffness, then tight hamstring which is located dun sa back part of our thigh. In a worst scenario, nakaka-experience sila ng difficulty standing and walking. Then for spondylolisthesis, severe or high-grade sleep may have tingling sensation, numbness, weakness of one or both of our legs. So, let us know naman the diagnostic tools that are used by our doctor. So, the most common use is X-ray. So, for X-rays, for spondylosis, which is yung OA of the spine, ang affected sa kanya is yung disc and nagkakaroon ng bony spur. So, through X-ray, makikita doon kung ano nang nangyari sa disc natin and if nagkaroon ng bony spur doon sa vertebra natin. So, check kung spondylosis ba siya. For spondylolysis naman, which is fracture of our pars intercalaris, so, ma-detect through X-ray kung nagkaroon ng fracture sa pars intercalaris, which is spondylolysis. Then for spondylolisthesis naman, check kung yung isang vertebra natin is nag-move forward or backward, which is spondylolisthesis. Then the usage of CT scan or computed tomography, more detailed lang siya kung i-compare natin kay X-ray. Then for MRI, kung si CT scan is more detailed kay X-ray, si MRI is mas detailed pa siya kay CT scan. Then for nuclear medicine bone scan with speck of the lumbar spine, it is used kapag hindi available si CT scan. So let us know naman yung treatment. So we have non-surgical treatment and surgical treatment. So let us first know what is the non-surgical treatment. So the usual na binibigay ni doctor for non-surgical treatment is rest. So na-explain ko na naman kanina na yung rest is binibigay para hindi magkaroon or hindi magkaroon ng additional pressure sa spinal nerves natin na naiipit. Then for NSAID or non-steroidal anti-inflammatory drug, ito yung mga pain reliever na binibigay or piniprescribe ni doctor para kahit papaano ma-relieve tayo sa pain na na-experience natin. There are times na nare-recommend ni doctor na physical therapy si patient para maturuan sila ng proper exercises para hindi mag-worse yung nararamdaman nilang symptoms or kahit papaano maka-experience sila ng relief of pain. Then for bracing, ginagamit to para i-support yung back natin para hindi siya put ng another pressure sa spine natin. Then for surgical treatment, it is used for severe or high-grade slippage that is progressively worsening, and back pain that has not improved after period of non-surgical treatment. So, this is the end stage na i-recommend na ni doctor yung surgical kapag hindi nag-take effect yung mga non-surgical treatment na na-recommend. So, let us know naman yung prevention na pwede nating malaman. Improving or maintaining the overall health of your spine, since these three diseases is related with our spine. So we need to develop a regular fitness routine. One of the exercises na best na pwede natin gawin is strengthening ng abdominals natin and ng back natin para ma-support yung spine natin in every time na mag-move tayo. Then, syempre, lose weight if necessary because kapag may pain na nga tayo na-experience, then medyo mabigat pa tayo, medyo nahihirapan yung spine natin na dalhin yung katawan natin, it can aggravate the pain na na-experience natin kasi nag-a-add sila ng another pressure dun sa spinal nerve na naiipit. Eat healthy, nutritious food that can make our spine stronger. Develop good posture, important yan kasi kapag nasanay tayo sa improper posture, there is tendency na yung muscle natin and bone natin mag-a-adapt na in a proper posture, which can lead to spondylosis, spondylolysis, and spondylolisthesis. Then learn how to live properly. So there are patient na gusto nilang magkaroon ng firm na muscle, pero the way mag-lift sila ng mga dumbbells is or yung mga binubuhat nila is not in a proper way. May mga times kasi na kapag buhat natin, mali yung position ng likod natin kaya nagkakaroon ng pressure dun sa hindi naman dapat malagyan ng pressure sa spine natin. Then of course, you need to get plenty of sleep kasi kailangan din ng pahinga ng spine natin. Then stop smoking because it can promote faster aging. Then avoid too much alcohol since it can cause dehydration. Then take a break throughout the day. Need natin ng i-change yung position natin from time to time kasi kapag nag-stick lang tayo sa position na yun, it can put pressure dun sa spine natin. Kaya naki-spin tayo minsan, di natin napapansin. After ng workload natin or after ng shift natin, masakit na yung likod natin kasi nakakalimutan natin i-change yung position natin from time to time. So, that's all for today. I hope you learned something from me. I'm Rachel Lingan, your clinical wellness speaker for today, reminding you that if some things go wrong, don't whine about it. Have spine about it. Just adapt, adjust, and move forward. So if you have question, clarification, or any suggestion of the topic you want to be discussed, feel free to reach out clinic team. I hope to see you again in our Wednesday Wellness webinar. That's all for today. Bye-bye.